Assalamu alaikum jami'an. Hello everyone. This is our ninth session in the preparatory course for the OSCE exam, MD Sudan, and it is available in the different platforms. One of the things that is new, it is available as well in the YouTube. My name is Dr. Amani Khalifa, and I'm Obs-Gyn consultant, Women Wellness and Research Center, Hamad Medical Corporation in Qatar, and I'm assistant professor and examiner in clinical MD Sudan, and organizer in the Arab board as well. I'm a president of Sudanese Doctors Association in Qatar. This is the ninth session in the course, and this session will be about family planning and contraception. I hope we will be able to cover all the aspects of family planning, types, indications, counseling, and different options as well. So if we would like to define the contraception is the intentional prevention of pregnancy during sexual intercourse. Birth control is the device and or practice to decrease the risk of conceiving or bearing offspring. With the wide assortments of birth control options available, it is possible for a woman to use several different contraceptive methods at various stages throughout her fertile years. So it is either the contraception, it is either chosen according to the patient or the family wish, which has nothing to do with the medical concern, or contraception due to any medical concerns of the patient. For example, any medical illness or any plan, obstetric performance, needed spacing between the pregnancies. What are the benefits of family planning? It prevents pregnancy-related health risks in the woman and reduces the need of unsafe abortion, reducing infant mortality, helping to prevent HIV and AIDS, empowering people and enhancing education, reducing adolescent pregnancies, and slowing population growth. These are the general benefits of the family planning. And if we talk about the maternal mortality and morbidity, it is one of the arms to reduce the morbidity and mortality, especially the mortality and morbidity related to the miscarriage or abortion in a low social classes area or in low social classes setting where pregnancy and abortion is unsafe for a patient in that circumstances. So family planning is one of the arms to reduce the maternal mortality and morbidity related to pregnancy and miscarriages. Is there any limitations? Yeah, there is limitations. Limited choice of methods, limited access to contraception, particularly among young people, poorer segments of populations, or unmarried people. Fear or experience of side effects, cultural or religious opposition, poor quality of available service. Can you please mute your mics? Okay, so the limitations is related to limited choice of methods, limited access, especially in poor settings or poor segments of population, or if a patient is unmarried and she wants to take a contraception, fear of experience of side effects, cultural or religious opposition. Still, we know that in some settings, in some cultural backgrounds, they thought that this is it's not acceptable to use a contraception. Poor quality of available services, and sometimes there is no different or available safe sources. The patient will lack the access to the service, or will lack the access to education about the service itself. Users and providers bias. Sometimes you will be biased by like companies that they are promoting certain types of contraceptives, or gender-based barriers. Gender-based barriers because males are not accepting very much the use of barriers and family planning barriers. So the load mainly will be, or the main responsibility will be over the shoulders of women. There are different methods, a variety of methods of family planning. And we can divide it into different types of classifications. We can divide them into natural and artificial. And the natural, as you know, I think this slide is not very clear. Natural and artificial. The natural methods are mainly the abstinence, the withdrawal, or the safe method, which is the calendar methods. The artificial, it could be either temporary or permanent methods of contraception. The temporary methods could be the barrier, the hormonal, the IUCD, or the copper T. And the permanent is either male or female. Male is tubal ligation, male is vasectomy, and female is the tubal ligation. So again, you can see the classification. We can classify the contraceptions into temporary, and the temporary will be hormonal or non-hormonal. And the permanent, either male or female. So if we look at the methods, we will have a different, the market is very rich with millions of types of contraceptive agents. The most commonly used, or the most widely known, is the combination of estrogen and progesterone contraceptive pills. And even this type, the pills, they are different formulation, different names, different concentration of the combined oral contraceptives. There is as well the transdermal patch, which is something we can say new, but it's not very, very new. And it's something that is there in the market for years now. And it is widely acceptable, and it is preferable by many humans and sectors. Vaginal ring, which is not widely used, is available. Progesterone on pills, injectable forms, intramuscular or subcutaneous, subdermal implants, implano, intrauterine devices, could be hormonal or non-hormonal, physical, chemical, or parallel techniques like herbicides and creams, and the barrier technique like surgical or nail condoms. Can you mute your mic, please? One mic is causing too much noise. Okay. Physiological or physical, like pre-ejaculatory withdrawal, sexual abstinence around the time of ovulation, breastfeeding, and permanent sterilization. These are the list a random list of the contraceptions. But we will talk in details about each type according to the category. This is the hormonal one. The hormonal contraceptives could be progestin only or combined. The progestin only could be either injectable Mirena IUD or implants or patches as well. The combined could be mainly pills, is the commonest type of the combined pills. And there were before a combined implants and combined injectable, which is now is out of the stock. It's out of the market actually. The non-hormonal is either the barrier methods or the calendar. The calendar method depends on the regular cycle. The cycle has to be regular. Can you please mute your mic? Whose mic is it? Okay. So we talk about the hormonal. When we said the hormonal is either progesterone only or combined. The non-hormonal is either the barrier
نزل استرلمت تحت تبقى خفيف به تشغل لك
please mute your mics because we cannot continue like this. Yes, please. Can you mute your mics, please? Okay. So we are talking about the hormonal and the non-hormonal. The non-hormonal is divided into the barrier methods. There are two types. Either the barrier methods, and the barrier methods could be male or female. And the other method is the calendar method. And the calendar methods, it has the period, the cycle has to be regular cycle for the more success rate of the calendar method, which is the safe method. The hormonal contraceptives, they are currently available oral, injectable, transdermal patch, and transvaginal ring forms. So from the hormonal, you will find all the modifications, all the modalities. Could be oral, could be injectable, could be transdermal, transvaginal ring forms. The most famous one is the combined oral contraceptives. The combined oral contraceptives, it has to be started on the first day. This is a quick start, or any day with a backup. So it's either start by during the cycle, the bleeding time, day one of the period, or at any time during the cycle with a backup method. It should be taken daily at the same time. And if by any chance a patient missed any pill, she should double the dose. So she will take the pill that she missed it whenever she remember, and she took the other one at the same time, or at the same time every day, that she's taking it every day. It could be monophasic or multiphasic. There are different formulation, different concentration. The concentration mainly is the estrogen concentration. It's 20, 25, 35, 50 grams. And the lesser, the smaller the concentration of estrogen, the better and the less side effects. لأنه الفورميوليشن ده ذاته تغيير in the concentration of estrogen. It has been done to improve the quality of the pills and to reduce the side effects of the pills. فكل ما كان concentration of estrogen is less in the pill, كل ما كانت more effective وكل ما كانت less side effects. The side effects in the combined pills is mainly due to estrogen. It has nothing to do with the progesterone. It is mainly by the estrogen. And that is why manufacturers, they work years and years to develop a contraceptive that with the least side effects, known side effects. And that's why they reduce the amount of estrogen to the extent that they go to a mini pill, which is the progesterone only pill. And then they formulate and they strengthen the progesterone, the type of the progesterone in the progesterone only pills, to increase the efficacy and to reduce the side effects. عشان كده كل ما كانت new generation progesterone pill, كل ما كانت better in the effect, كل ما كانت less side effects. The combined, as we said, oral, it's high success. Self-administered, لأنها oral, this is the advantage. Reversible, once it is a woman stop using the combined contraceptive, she will regain her fertility, if not immediately, after few months of stopping. It is cheap and available, very cheap and available. Yasmin and كل types of combined contraceptives in the market are very cheap. They don't need storage, certain storage, ولا cold, ولا they could be in a normal temperature, over the counter, in a room temperature. Other benefit of the combined pills, there is no intermenstrual period. Actually, it regulates the cycle, and it's one of the uses of non-contraceptive uses of the combined pills. Okay, and this also, it has to be covered here. The non-contraceptive uses of contraceptives, especially the combined pill. How it acts, a combined pill? How it will act?
suppress الovulation.
وبتعمل thick للcervical mucosa.
Okay.
disturb الendometrium.
ما أفضل قاعد يذاكر لولد ولا بنت يا إخوان والله. This is very good. لكن يعني أنت بتذاكر أنت وبتذاكر لولدك ولا بنتك. Can you mute your mic, please? So it suppresses it suppresses the ovulation, it sickens the cervical mucus, and it makes the endometrium hostile. And I ask here because the combined contraceptive, it acts يعني triple action. الأكشن بتاع triple action. It does not only suppress the ovulation, لكن it suppress the ovulation, it sickens the cervical mucus, and by thickening the cervical mucus, make it less, we can say less permeable for the sperms to go, but it is less motility, and motility of it impairs the motility of the sperms to pass through the cervical mucus and makes the endometrium hostile for the implantation. So by this action, by the triple action, it prevents the pregnancy. Disadvantages, what are the disadvantages? What are the disadvantages?
breakthrough bleeding ممكن في ال first 3 months والموت disturbance weight gain عندها high risk of DVT
Breakthrough. Okay.
وعندها ريسك على اللي هي شنو الاندوميتريال والاوفيريان كانسرز increase the risk.
Is it? دي من الظهور ولا دي من الجوابات؟
خضرة
خضراء. معلش أنا لأنه ما ظهر لي الأسماء، لأنه خدت السكرين بتاعتي. نو يا خضراء. السايد disadvantages دي it reduces. أيوة it does not increase the ovarian cancer. بالعكس.
reduce the
It will not
ovarian.
cause a breakthrough.
Yeah,
It will not
increase
cause
the risk.
breakthrough. بالعكس هي decrease الانترميستال bleeding. البريك ثرو او الويزدرول bleeding بيحصل بعد stopping، مش في الفيرست 3 months. الcombined contraceptives. I'm talking about combined contraceptives. What are the disadvantages of combined contraceptives?
Increase the risk of
Increase
breast
the risk of
cancer or
DVT.
cervical.
And increase the risk of deep vein thrombosis,
Increase
especially
the
في
risk of
الأوبيز.
breast cancer or cervical cancer.
headache, nausea, and
حرام
vomit.
عليك، قومي.
ايوه.
increase the risk of MI according للage والsmoking.
طيب if I am a patient or I'm not a patient, I'm a client. If I am a client coming to you for counseling, and you start saying to me that the counseling you started by saying it increases the incidence of breast cancer, I will not take it. You don't start with the least and not common and most serious disadvantage. Uncommon disadvantage. The common, what is the common disadvantage?
المسبل يا بوس. المسبل.
Headache, nausea, and vomiting.
مسبل يا بوس.
Okay.
هي oral administration. هي can be إنها تتأثر بالنوزيا بالvomiting، يعني أي intestinal obstruction، وبأي drugs.
The types of
change in
meal.
mood يا boss. Increase in weight.
أيوة. Think of simple things. Weight gain, hair loss. It can be missed. عشان كده very easy to be missed لأنها person administered oral. The more it is missed, the more is the lower the pill index and the more the pregnancy rate. A disadvantage, you need to start by the simple things. عشان كده أنا سألتكم. I know all of you knows that إنها هي بتعمل شنو والside effects بتاعتها شنو. لكن the way you should answer in the exam is not like this. You have to be very systematic and think, organize yourself while يعني before answering you have to organize yourself. Disadvantage أول حاجة في disadvantage إنها هي daily use. Something that is to be used daily. You either forget it or you either bored from using it. Okay?
Or
Daily
delay.
use. There is no protection of sexually transmitted disease or HIV. It can cause obesity, hair loss, GI upset, breakthrough bleeding after stopping of it. It increases the T4, the thyroglobulin binding, and the cortisol. It increases the triglycerides, the cholesterols, and HDL. It lowers the LDL, the protective one. Have you seen here we mentioned any cancer? عشان كده don't jump to the things that is دي واحدة من الكونترا indications أو إنها هي it is theoretical حتى the increased risk of breast cancer is theoretical risk. The combined oral contraceptive, they are different therapy. Ethinyl estradiol or estradiol variate plus one of the progestogens. And progestogen, mute your mic, please. يعني which mic is this يا جماعة? Who is this mic? Who is this mic?
أنا
يا بس ممكن تخلي خالد من عنده هناك الكنترول حقه ونوقف كل المايكات يعني ما فيه يتكلم.
سناء وشيماء تقريبا ديل الاثنين المايكات مفتوحة. سناء وشيماء.
Okay, I muted all. Okay, now you can hear me, huh? The combined oral contraceptives, as I said before, it is estrogen plus progestogen. And the progestogen is a different formulation of the progestogen according to the generation. So it is ethinyl estradiol or estradiol valeriate plus one of the progestogens. The progestogens are divided into 3 and 4 generations. First generation progestogen هو النورثندرول, second generation progestogen levonorgestrel and norethindrone, and this is the most famous types of progestogen, levonorgestrel and norethindrone. The third and fourth generation progestogen, these are the new generation progestogens, and they are the progestogens that is mostly effective, and it resembles in its effect, it resembles the estrogen without the side effects of the estrogen. And that's why it is very popular. The third and fourth generation progestogen, the histidine and desogestrel. Desogestrel is the most famous one. Norgestimate and drospirenone. Drospirenone هو الياسمين أو الداينوجست أو النومنجسترول. النومنجسترول acetate. So there are different third and fourth generation progestogen. The most famous one that you need to know is the desogestrel اللي هو أكتر واحد famous هو desogestrel اللي هي السيرازات, which is widely available and it is available in Sudan and everywhere. Desogestrel. Okay, and the drospirenone اللي هي الياسمين, which is widely available as well. So this is the combined. This third and fourth generation progestogen, there are different formulation of it. It can be found as oral or injectable or implants, as implants. The combined oral contraceptives as either monophasic or biphasic. The monophasic, in the monophasic type, when we say monophasic, the dose in each tablet is fixed. So any tablet, it has the same dose of estrogen and progestogen in each tablet. In the biphasic, the variable doses. Biphasic, اللي هي same estrogen with 2 doses of progestogen, or triphasic, same dose of estrogen and 3 doses of progestogen. 2/3 doses of estrogen and 2/3 doses of progestogen. Why the biphasic and the triphasic, why this formulation is different? عشان to resemble the level of the hormone during the normal period. In each time of the cycle, you have a different need for the different level of hormone needed to suppress the ovulation and to continue the effect of the contraception. What are the contraindications of oral combined contraceptives? What are the contraindications?
الكاردياك ديزيز اللي هو الكلاس 3 and class 4.
Okay.
Previous thrombosis.
Personal history of thrombosis.
Uncontrolled
liver disease.
hypertension.
Active liver disease.
Active liver disease.
Uncontrolled diabetic, uncontrolled hypertension.
history of cancer, breast
migraine,
cancer,
aurora,
breast cancer,
current breast cancer.
Current breast cancer. Diabetes only with vascular involvement, and a patient with angiopathy, diabetic angiopathy, severe hypertension, known or suspected breast carcinoma, carcinoma of the endometrium or other known or suspected estrogen-dependent neoplasia, undiagnosed abnormal genital bleeding. So thrombotic disorder or thrombophlebitis, cerebrovascular or coronary artery disease. حتى في الهارت لازم يكون عندنا coronary artery disease or thrombogenic cardiac valvopathy, thrombogenic heart arrhythmias, diabetes with vascular involvement عشان ما أي diabetes is contraindicated, severe hypertension, known or suspected breast carcinoma, carcinoma of the endometrium or other known or suspected estrogen-dependent neoplasia, or undiagnosed abnormal genital bleeding, cholestatic jaundice of pregnancy or jaundice with pill, hepatic adenomas or carcinoma or active liver disease. Known or suspected pregnancy, major surgery with prolonged immobilization. These are the contraindications. Right. Now, this is all about the combined contraceptives. So the combined oral contraceptives, قلنا it's estrogen and progesterone, and they are different formulation. It is easy, it is self-administered, it is oral, it doesn't need any storage circumstances, can be stored in a normal temperature. Its efficacy is very high. It is safe as well, providing that we exclude the contraindication. The disadvantage, it is daily use, that is against it. It is daily use. It can cause obesity and hair loss. It can cause GI upset because it is administered orally, okay? And it can cause, in some cases, breakthrough bleeding after stopping the pills. The contraindication, as we mentioned, the list of contraindications. If you say diabetes, you have to say diabetes with vascular disease, hypertension, severe hypertension, thrombosis related, yani any thrombotic event in the patient, or thrombotic heart disease, or thrombotic cerebrovascular accident, or thrombotic valvular lesion in the heart, active liver disease, and CA breast, and CA endometrium, or pregnancy itself, or any related estrogen-dependent neoplasia. Then we will move to the transdermal administration. احنا اتكلمنا عن الاورال administration اللي هي الكومبايند، او هنتكلم كمان عن البروجسترون اونلي اللي هي فيها 4 generation of progesterone. A transdermal administration, the patch may be applied to the buttocks, to upper outer arm, lower abdomen, or upper torso, but the breasts are avoided. So the main places, إما الباتوك أو الupper outer arm. Most commonly بتخدى وين؟ عادة في الupper back over the scapular area. This is the most common site widely used. Sorry. It has inner layer containing a adhesive and hormone matrix with a water-resistant outer layer. That means once it is there, a patient can take a shower normally, she can do swimming, whatever she wants, she can do, and it will not interfere with the concentration of the hormone that is released from the patch. Initiation of the patch is the same as for COX, and the new patch is applied weekly for 3 weeks, followed by a patch-free week to allow withdrawal bleeding. طيب initiation يعني ممكن نبدأ في first day of the period or at any time during the period لكن with a backup method. At first day of the period, the patient will put a patch. The patch will stay for 1 week and she has to use 3 consecutive weeks وبعدين 1 week free of the patch. And during this time, she will have her period. The candidates for the patch should weigh less than 90 kilograms and have no risk factors for cardiovascular disease and thromboembolism. This is the commonest place for the patch. It will be put usually here because it is accessible for the patient herself. Easy. She will put it on her shoulder, over her shoulder in the back, and it will be away from the breast. So what are the advantages of this method?
Yeah,
What are the advantages of this method?
Easy and self-applied.
Yes.
بتقلل لنا reduce the risk of missed يعني less failure rate.
It is not daily use. So it is once in a week. So it is compliant will be high with her. There is no nausea and there is no interference with food. She can take it and she will do her daily activities. So what is the patch? Each patch 20 centimeter square of a patch. هي عبارة عن 20 centimeter square. It contains 600 microgram of ethinyl estradiol, that is estrogen, and 6 milligram of norgestronium. norgestromine. النورجسترومين هو second generation progestogen. Per 24 hours, it secretes 34 microgram of ethinyl estradiol and 203 microgram of norgestromine. Transdermal, each 20 centimeter square of patch contains the contraceptives, all contraceptives. It will be once weekly, 3 weeks on and 1 week off. And it's not affected by the GI upset and may cause skin irritation. The side effects or the disadvantage that it might cause some skin irritation. Right. Disadvantage, it is not widely available. It is not cheap as the oral combined contraceptives. لكنها it is form of combined contraceptives, non-oral combined contraceptives. The transvaginal administration, there is a transvaginal ring which is called the Nova ring. Nova ring is estrogen progestogen releasing vaginal contraceptive. It's a flexible ring, intravaginal hormonal contraceptive ring constructed of ethinyl vinyl acetate, and the ring measures 54 millimeter in diameter and 4 millimeter in cross section. It contains ethinyl estradiol and progestogen etonogestrel. Etonogestrel as well is third generation progestogen. This is the Nova ring. Nova ring is a small flexible ring. It is hormone containing. It will secrete both ethinyl estradiol and progestogen. Flexible, transparent ring, 54 millimeters wide and 4 millimeter thick. It contains 2.7 milligram of ethinyl estradiol, as you see here, very low dose of ethinyl estradiol, and 11.7 milligram of etonogestrel per 24 hours. 15 microgram of ethinyl estradiol and 120 microgram of etonogestrel. So this is the content of the 2.7 milligram and 11.7 milligram. This is the content. But per 24 hours, it secretes 15 microgram of ethinyl estradiol and 120 microgram of etonogestrel. It will be in situ for 21 days, removed for 7 days, and the new ring inserted for the next 21 days. So it is the same, 3 weeks, same as the patch, but it will be inserted for the 3 weeks. The patch is inserted weekly, while the Nova ring inserted for 3 weeks. And after the 3 weeks, it has to be removed, and the patient will be free of any contraception for 7 days. That is the time that she should have her period. And again, she will resume using the Nova ring at the end of the period. Definitely, this type of contraception, we cannot use it at the time of the bleeding time. So the patient has to be at least clean from the bleeding. Intramuscular administration, injection, contraceptive injections containing 25 milligram of medroxyprogesterone acetate and 5 milligram of estradiol cypionate. طبعا الاستراديول cypionate is not anymore added. It's no longer available. The available contrast injectable form is progestogen only, which is a depot, the medroxyprogesterone acetate depot. The one that we were discussing is the combined formulation. يعني combined formulation of contraception, estrogen and progestogen. There is oral, there is a patch, there is a ring, there is an injection that is not available anymore. It's only the oral and the patch and the ring in the combined formulation. Progestational contraceptives, progestogen only contraceptives are widely used, and there is different formulation. There is an oral form, there is injectable, there is local, there is transdermal, there is intravaginal, transvaginal, intrauterine. So the oral is a progestogen only. This is a mini pill. The injectable forms, which is the medroxyprogesterone acetate, Depo-Provera, which contains 150 milligram that is injected every 3 months, and norcesterone ethansate. There is a different formulation, which is Norigest, 200 milligram every 2 months, and subcutaneous version, Depo Sub-Q Provera 104 is available and injected into the subcutaneous tissue of the anterior thigh or abdomen every 3 months. And the pregnancy rate is very low, of 0.3%. The implant, this is the injectable, and the implant. The implant, there is the Implanon, which is a single rod subdermal implant with 68 milligram of the progestogen etonogestrel and anisanyl vinyl acetate copolymer cover. Progestogen only pills, there is different formulation. Cerazette, which contains the desogestrel, Micronor 350, this is the norcesterone, Norgistone, which is the levonorgestrel, or Noridia or Noriday, norcesterone. So the different formulations. The most famous is the Micronor, which is the norcesterone, and the Cerazette, which is the desogestrel. Benefits: it is safe in a woman with a history of migraine, with or without aura, and it is safe in DVT. It can be used in DVT. Side effects: headache, breast pain, acne, nausea, changes in libido, and changes in bleeding patterns are common. Medroxyprogestogen acetate, which is the Depo-Provera, the injection form, it acts by inhibits the ovulation, effects on the endometrium, and sequence the cervical mucus. So the action, it shares the same action with the combined pills, the estrogen and progesterone pills. The side effects, the main side effects of Depo-Provera is the irregular menstrual bleeding and prolonged anovulation after discontinuation, which results in delayed fertility resumption. عشان كده when you choose a Depo-Provera, you need to know the patient, the wish for her fertility, future fertility of the patient is very important. If a patient wants, she's para 1, for example, and she's still planning, you avoid advising her to take a Depo-Provera. Usually Depo-Provera should be like for a patients, for women who are either completed their family or they want long duration of contraception, more than 5 years of contraception. Another side effect is the weight gain, breast tenderness, depression, loss of bone mineral density, the progestogen only subdermal implant زي nexoplanon or implanon. طبعا it was before, it was available years back, and it was 3 rods, كانت 7 rods وبعدين 3 rods, and lately it become a single rod. A single rod implanon. A core is 37% is vinyl acetate copolymer, and containing 60% etogenestrel, which released 68 milligram. 3% barium sulfate, 15 milligram. These are the constituents of the rod itself. But the hormone is only etogenestrel, which is a third generation progestogen, and it will be released on daily basis. It maintains the level of the progestogen high during the period of during the 3 years period of insertion. Nexaplanon or implanon contains 68 milligram etogenestrel, effective for 3 years. It should be inserted at the non-dominant upper arm subcutaneously. I believe all of you, because it is very widely available in Sudan, I believe all of you had the experience to insert it and to remove it. And I think there is a dedicated workshop, family planning workshop. We were training the people in Sudan for this for a long time. I was one of the instructors doing this workshop. It will be effective for 3 years for non-dominant hand. It is very important to ask a patient, is he left-handed or right-handed? And you put it in the arm. It doesn't need anything. The insertion is very easy. You might use a local anesthesia, and you might not need to use it. Failure rate is very low, very, very low, less than 0.05 over 1 year. It inhibits ovulation only. It acts on the ovulation. Intrauterine devices, it could be active or inactive. The active one, that is hormone containing, which is the levogestrel intrauterine system. So it is not a device, it's a system, levogestrel intrauterine system. That is why it is LNG IUS, or the copper T. Copper T as well is active form. Or inert IUD. The inert IUD, like the horseshoe IUD. It is inert. There is no copper in it. It is not active. It is just blocking the place where pregnancy can occur. This is the Mirena. And I think in the skills we need to do as well, in the gyne skills especially. I think next session, inshallah, we'll do the skills for the OSCE. واحدة من skills that we need to do it, the Mirena insertion. What are the disadvantages of intrauterine device?
It may cause the unscheduled bleeding.
Bleeding, menorrhagia.
Risk of expulsion,
Infection, perforation.
infection and perforation, and difficulty in insertion.
أول حاجة في disadvantages non self administered.
إذا حصل لنا بريجنسي يكون هاي ريسك بتاع اكتوبيك إذا حصل بريجنسي.
أيوة, if pregnancy occurs, the incidence of ectopic pregnancy is high. Uterine perforation, expulsion, lost device, cramping and bleeding, menorrhagia, infection, pregnancy with an IUD. Okay. The barrier methods. There are different types of barrier methods. Female, there is a female condom and a male condom. The failure rate of the male condom is 3 to 4 per 100. So it is high, very high failure rate. key steps to ensure maximal condom effectiveness. A condom must be used with every coital act. It should be in place before contact of the penis with the vagina. Withdrawals of the condom must be held during withdrawal عشان to avoid any spillage. Either an intravaginal spermicide or a condom lubricant. Increase the protection with the condom. These are the things that has to be done with the use. This is a female condoms. There are different shapes. There is a diaphragm, cervical diaphragm, vaginal condom, or cervical condom. Fertility awareness based method. This is the calendar method. Standard days method 8 to 19. And the calendar rhythm method, temperature rhythm method, cervical mucus rhythm method, and symptothermal method. And all this is detecting the time of ovulation. The success rate is very low of the calendar method, and the requirement is mainly the patient has to have a regular cycle. Otherwise, it will not be correct. Regular cycle is very important, having a regular cycle. And the advantage of this method is avoiding any hormonal effect of the method. It is safe. It doesn't need any intervention. It doesn't need, it's a self-administered by herself or self-applied. And the side effect is failure rate. It's high failure rate. Emergency contraception. What are the current methods of emergency contraception?
الفيرست لاين الكبر ايودي.
What is available in
الكبر ايودي
copper iodine?
ده up to 5 days. وعندنا الليفينوجستريل ده اذا كان up to 3 days
يوريبليستال اسيتيت.
اسيتيت. ايوه ده برضه up to 5 days.
اليوريبريستال اسيتات اللي هو شنو؟
بروجسترون موديوليتر.
اللي هو المايفيبرستون. المايفيبرستون is another option.
Mifepristone not used as emergency contraception.
اليوريبروستال is available عندنا في السودان فيه ولا ما فيه؟
No, not available.
It's not available. طيب if it is not available, what is the other option? إذا عايزين ندي
increase
oral.
الدوز. increase dose يعني high dose of progestogens up to 3 to 5 taps.
طيب اليوريبريستال is not available. طيب ليه من قال مايفيبرستون cannot be used as emergency contraception? اليوريبروستال is antiprogestogen. What is the mifepristone?
It is antiprogesterone also.
It is also antiprogestogen. عشان كده المifepristone can be used as emergency contraception. طب current methods of emergency contraception include a combined pills, progesterone only products, copper containing IUDs, and mifepristone and the uripristine. Treatment consists of 2 doses taken 12 hours apart. Use an antiemetic agent before each dose will lessen the risk of nausea, which is a common side effect, and reduces, if any vomiting happens, while it is increased, reduces the effect of the contraception. Number of pills depends on the concentration of the progesterone. So it is either 1, 2, 4, 5 per dose. Optimally, the first dose is taken within 72 hours of unprotected coitus, but may be given up to 120 hours. The second dose follows 12 hours later. But if you use it up to 120 hours, you have to have another backup method. The other types are the copper-containing intrauterine device, and it can be used up to 5 days after unprotected intercourse, and it is very effective. The failure rate is 1%. Mifepristone, single 10 milligram dose, provides pregnancy prevention compared with that of Plan B. So, if you want to counsel a patient for family planning or contraception, there are certain points has to be very clear. Age, parity, obstetric performance, and obstetric wish of the patient. Menstrual history, if she's having regular cycle or irregular cycle. Past medical history, especially diabetes, hypertension, VTE, migraine. If she's taking any drugs, for example, epileptic, and taking any one of the anti-epileptic medications. BMI is very important because it increases the risk of the side effects. And while counseling, there is a certain technique in the counseling for family planning or contraception. Actually, this the technique like a mnemonic that is used widely for all forms of counseling. And whenever you want to counsel a patient for anything that you need to counsel, for the management, for the disease, for the options of surgery, for anything, you can follow the same mnemonic, which is called gather. gather يعني تجميع، مش كده gather يعني أو تجمع. gather G stands for greet the client respectfully. A, ask them about their family planning needs. يعني A is ask for family planning needs, relevant history, medical disorders, drugs she's taking, anything you ask. That means this is the A stands for collecting relevant history. T stands for tell them about different contraceptive options and methods. Then you start by telling them different contraceptive options and methods. H stands for help them to make decisions about choices of methods. What type of methods they would like to. For example, she will tell you, Wallahi, I am in doubt. I am not a person who remember very well to take the pills, but I don't want any, I'm scared of any injection. So what do you suggest for me? For example, you might offer her an implant on 10. You tell her, okay, in this case, it might be better for you to have one injection of implanon that is once for 3 years, not like an injection that you will take every 3 months, or not like a pill that you need to remember every day. So you help them, you guide them to make decisions about choices of methods. Okay, once they choose, خلاص, they decided about one method of contraception, then it comes to E. E, explain and demonstrate how to use the method. Okay? R, stands for return or refer, schedule, and carry out a return visit and follow-up. Is it clear? This gather technique. This gather technique it is very important. زي لو متذكرين في الأول one of the first sessions we talk بسرعة about counseling. I think we need a special session about counseling وهيكون فيها examples كتيرة للcounseling. All the types of counseling that might come in the exam اللي هي زي counseling, breaking bad news, counseling for mode of delivery, counseling for VBAC, counseling for management of miscarriage, counseling for report breaking bad news. If you remember in the breaking bad news كنا بنستعمل يا mnemonic. Which mnemonic for the breaking bad news?
الأسيست. أسيست يا بوس.
النيمونيك اللي كنا بنستعمله for the breaking bad news في الكونسلنج. نسيتوا؟ spikes. طيب هنعمل سيشن عن الكونسلنج. قلنا spikes for breaking bad news and gather for the counseling in general. Gather technique. Gather technique. Greet the client respectfully. Ask, tell about the different, help to choose, explain and demonstrate, return and refer. ودي السكيلتون اللي انت بتدخل بها الامتحان. يعني once you are going for a station والستيشن دي عنا counseling بتكون ال5 أو ال6 elements ديل ماسكهم في يدك كده and you will say GATHER 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 greet ask tell help explain and return or refer. This is the gather technique. In the gather technique or in the counseling, you need to know how well does the method prevent pregnancy. That is very important. What are your feelings about getting pregnant? What an unplanned pregnancy create hardship or distress to a woman or her partner? How much does a method of birth control cost? The cost. What are the health risks? Is she having any medical risk? Is your partner willing to accept and use a given method of birth control? Do you want a method that you only need to use when you have sex, or do you want something that is in place and always working? Is preventing infections spread by sexual contact important for you? Many methods do not protect you from sexually transmitted infections. Condoms are the best choice for preventing STIs. They work best when combined with spermicides. The availability is very important. Can the method be used without a prescription, a healthcare provider visit, or in the case of minors, parental consent? إذا كانت age less than 18, then a parental consent, it has to be there. What are the types of medical conditions that makes the pregnancy especially risky, and you need to be careful while prescribing any contraceptions or advising for any contraceptions? Diabetes plus nephropathy, retinopathy, hypertensive ischemic heart disease, anemia, CA breast and CA endometrium, and neurogenic epilepsy. The Pearl Index, while counseling a patient or a family about the pregnancy and the contraception, it is very important to know the Pearl Index. And you can see here in this arrow from less effective to the most effective. The most effective types of contraception are the implants, implanons, vasectomy, sterilization, and IUD. Actually, the IUD and implanon as equal as female sterilization. Less is the injectable forms, but it needs repetition or repeat injection after every 3 months. Less is the pills. All these forms are considered strong contraceptives with high pill index. Okay, and then it is actually 0.03 to 0.05 the incidence of pregnancy or the pill index in this form. The pills is and safe method or must follow LAM instructions. Okay, this is the breastfeeding method or the calendar method. The condoms and diaphragm and the female condoms are all less, but male condom is better than the female condoms. And fertility awareness based method اللي هي الكالندر method. Spermicides is the least one. But if you combine a spermicide with a male condom, then the success rate is high and the pregnancy rate is low. So the WHO, they classified contraindications of our diseases and use of contraception with diseases into 4 colors. Green is safe. Yellow, you can use. Advantage generally outweighs the theoretical events, proven risk. Orange, methods not usually recommended unless other more appropriate methods are not available or are not acceptable. Red is not to be used. So contraindicated should be red, which is stop. So green for go. Yellow, usually yes. Orange, better not to be used unless it is indicated or the other methods are not available. Red should not be used at all. So this is a color-coded classification of the WHO. ده بيذكرنا بالوايت امبر and green بتاع sorry white amber and red بتاع الكلاسيفيكيشن new classification 2022 of NICE بتاع CTG. مش كده؟ it resembles it. Definitely I will not discuss all this table. Like the thing that you need to see that the green is most commonly used. لكن in most of the types خصوصا لما تيجي تشوفوا الكوبر IUD يعني الكوبر IUD always green except لما يكون عندنا cancer awaiting treatment. لو الكانسر ما معرفوش cervical intraepithelial neoplasia أو any other cancer. Cancer awaiting treatment. So copper IUD is the most safe one. Alprogestine IUD is the second one. Alprogestine only pill, a patch or ring, you can see it is mostly better to be avoided unless in the gestational diabetes in the past, gestational diabetes only in the past or depression. Otherwise, it is not the most popular, but the most popular here is the IUD. Here again, you can see venous thrombosis, copper IUD, especially except if there is current DVT, it is better not to be used. Like if the risk outweigh, you can use it. So the copper IUD is either green or yellow. It is only red in one situation, not to be used in only one condition, which is cancer awaiting diagnosis. Still, there is no diagnosis of the cancer. Any other thing, copper IUD can be used. Progestin IUD can be used mostly unless in the breast cancer. When there is current breast cancer. If there is previous or family history of breast cancer, it can be used. Okay, progestogen only implants are also safe, except in the breast cancer, in the current breast cancer. So the current breast cancer, all progestogen containing or hormonal containing are contraindicated in the breast cancer, current breast cancer. It has to be current breast cancer, okay? Except the IUD. This color coded, it makes things easy for the one to choose the type of the contraception according to the medical illness. Even here, the drug interaction, it is clear that drug interaction, anticonvulsants, IUD and copper IUD and progestogen IUD and progesterone only injection can be used. Avoid the combined pills and avoid the progestogen only pills. Okay, unless otherwise others are not available. Lamotrigine alone, all can be used, even the progestogen only pills. Only the estrogen containing should not be used. Rifampicin, IUD, progestogen, IUD, and progestogen only injection can be used safely. So this color coded is available. It should be available in all the clinics of family planning clinics. The take-home messages from this presentation. The gather technique for the counseling, the different formulation of contraceptives. You need to be aware about all the types, and you have to give the patient and her husband or her partner the full information of the all options. First of all, setting. In all counseling sessions, the setting is very important. So you set the agenda for the meeting, and you set the environment and the discussion environment. And then you start by greet the patient and greet respectfully, eye-to-eye contact, and gain the trust of the patient and her husband. Then you get history, relevant history, the important history in contraceptions or family planning is the age is very important. The previous or the pregnancy obstetric performance, the previous and the future performance, if she wants or she doesn't want, she completed her family, she had multiple cesareans, whatever. The obstetric history is very important, and the gynecological history, especially the regularity of the cycle, if she's having menorrhagia, if she's having intermenstrual bleeding or irregular cycle, any vaginal discharge or PID or whatever infection, any history of ectopic pregnancy before. And then after you ask, we said we're gonna gather, G, greet, A, ask, and T stands for telling the patient are the different options. You tell her, you start by telling her there are different options of family planning methods. We have the oral, we have the injection, we have the IUCD, okay, and we have other methods that can be used and removed during the intercourse or the time of the intercourse. Then you help the patient and her husband or her family or partner to choose the type. After they decided that they will use one type, then you give them the full details tell them about describe or tell them about, explain to them all the details about the method that we'll use. For example, if you want to put implanon for them, they decided on implanon, then you bring out the implanon You show them the implanon. This is the implanon, okay? And it is an injectable, and it will be injected as a subcutaneous area and your arm, and it is not painful procedure. It might require local anesthesia only. It's a single rod. The size of the rod is like 4 centimeters length with 0.5 or 0.3 millimeter width. And this implanon will not affect your daily activity. You can take wash, you can do whatever you want while it is there. It will stay for 3 years. You explain everything. This is an IUD. The IUD, you will be on the lysotomy position. The application of the insertion is not painful, but it is uncomfortable. You need to evacuate your bladder first, and then we will put it, we'll do it gently. We'll insert it there. There is a thread, and this thread, we will cut this thread, and you will be able to feel. The thread is to pull it when we want to remove it, okay? And we will make sure that the IUD in place. After the first day, you might have some cramps. For that, we will prescribe for you some analgesia or medication, and it has to be inserted while in the 5th day of the cycle, better 5th to 6th or 7th day of the period. And that is the thing. So you explain everything about it, the side effects. Your husband, it will not harm your husband. It might cause some menorrhagia. If we will give you, and then at the end it comes the R, which is the refer. So this is the card. We write everything about the method that you use, and you have a follow-up after the first period. You will come, we will do an ultrasound, or you will come after 6 months for checkup, okay? At any time you feel that you want to remove, for example, if we put implanor or IUD, this is the contact number. You can call this number and you can book for coming for removal, okay? In case you feel any pain or bleeding or that is intolerable, you can go directly to the emergency. This is in the R. So R, when to return, what are the symptoms that should bring the patient back to the clinic or to the emergency, and when is the referral follow-up for her. Okay. Thank you very much. Any questions?
Thank you very much, Abbas. It is very simplified and summarized and very informative. Thank you very much, Mot.
شكرا يا باص، كتر خيرك
Thank you,
كتير.
dear.
ما
Thank you so
قصرتي
much.
في ميزان حسناتك يا رب.
اللهم آمين يا رب. I think Khalid is here. We can stop the recording now.